Hydrocephalus is a term that we use to describe enlargement of the fluid spaces within the brain. The brain is protected by sitting in the skull cavity surrounded by water. That water must circulate and be reabsorbed. In children with myelomeningocele, there's a higher incidence of that fluid not absorbing correctly or not circulating correctly, and therefore additional procedures are sometimes necessary to deal with the fluid. They can include placement of a ventricular peritoneal shunt, or in some children using sometimes bypass procedures for the fluid. It becomes important to assess that early in life, as enlargement of the fluid spaces can cause pressure on the brain and therefore brain dysfunction. And we obviously want to avoid that at all costs. And so repeat evaluation of the fluid spaces of the brain through a variety of radiologic techniques, including ultrasound, MRI scans, and CT scans, may be necessary as the child grows in the first several years of life. If a shunt or a device is used to drain the fluid, it may be necessary to do repeated imaging of that over the individual's entire life. So that becomes one of the most important things that we need to evaluate in the first days after the baby is born.